Now that we know the general histological structure of the gastrointestinal tract, in this video we'll focus on the specific esophagus histology. Welcome to a brand new class on DNMD, where you can learn everything related about the basic sciences of medical knowledge and apply it to patient care in the future or right now. The esophagus is the first part of the gastrointestinal tract that possesses all of these four characteristic layers. We'll begin talking about the first layer, the esophageal mucosa. The covering epithelium of the mucosa is a non-keratinized stratified squamous epithelium. The cells of this epithelium that are closest to the basement membrane form the basal layer of the epithelium. These are cuboidal basophilic cells that have a high mitotic rate and are capable of regenerating the whole epithelia. These cells travel from the basal border of the epithelia to the apical border, regenerating each layer of cells until the top layer peels off. This renewal of esophageal epithelial cells takes around 14 to 21 days to complete. Other than the regular epithelial cells in the basal layer, we can also find in the esophagus melanocytes. These cells are normally found on your skin and are the responsibles for secreting melanin, the pigment that gives you your skin color. These can group, forming visible clusters called melanosis esophagi. This is a benign lesion, but that can also be a precursor of primary esophageal melanoma, a type of skin cancer. The basal layer also contains Merkel cells. These are neuroendocrine cells that are commonly located in the skin, but their function in the esophagus is not known. These cells can be the origin of different neuroendocrine tumors of the esophagus. Above the basal layer, the epithelial cells start to flatten out, becoming progressively more squamous, and start to accumulate glycogen inside its cytoplasm. This causes the cytoplasm to appear white, kind of washout, in the typical preparations for light microscopy. Above the basal layer, we can find T lymphocytes and Langerhans cells that act as antigen-presenting cells. Remember that, as we have learned in the previous epithelial video, below this basal border of cells lies extracellular matrix known as basement membrane, and below this basement membrane we can find the lamina propria, that is connective tissue. This lamina propria in the esophagus extends towards the epithelium through extensions that are shaped like fingers called papillae. These papillae penetrate the inferior two-thirds of the esophageal epithelium. Besides containing blood vessels, the lamina propria also contains glands. These glands are simple tubular glands called esophageal cardiac glands. They are called cardiac glands because they resemble the cardiac gastric glands, and they are located in the proximal esophagus near the union with the pharynx, and also in the distal esophagus near the gastroesophageal junction. These glands are in charge of secreting neutral mucin to form mucus, and they are not always present. They can be found in only 16% of the population's esophagy. The final layer of the esophageal mucosa, the Muscularis mucosae, is made up of smooth muscle with longitudinal fibers. This layer is thin in the proximal esophagus and starts to grow thicker as it approaches the distal esophagus. In the gastroesophageal junction, the Muscularis mucosae of the esophagus is even thicker than the one of the stomach. Its contraction is the one that creates the folds of the esophageal mucosa. There's an important histological region in the esophagus known as the C-line, also known as ora serrata, or the squamo-columnar junction. This region represents the transition between the non-keratinized stratified squamous epithelium of the esophagus to the simple columnar epithelium of the stomach. This area is also visible via endoscopy because the gastric epithelium is red while the esophageal epithelium is kind of pale or pink. This area is important because it's a common location of esophageal cancer. Apart from the typical characteristics already discussed, the esophageal submucosa contains compound tubular glands known as esophageal glands that are located in all the length of the esophagus. They are in charge of producing acidic mucin for the creation of mucus that helps with the lubrication of the esophageal lumen, but that is not strong enough to protect against the gastric acid in gastroesophageal reflux disease. This mucus is transported to the esophageal lumen through ducts that go through the mucosa. The obstruction of these ducts due to inflammation or fibrosis is the cause of a strange disease known as esophageal intramural pseudodiverticulosis. As we can see here, these small holes in the esophageal mucosa are the dilated submucosal gland ducts that are obstructed. The esophageal muscularis externa is special because it is made up of two different types of muscle. In the proximal esophagus is exclusively made by a skeletal muscle, and it can be in the proximal 5% or the proximal 33% that represents the proximal 1/3 of the esophagus. The middle 1/3 of the esophagus is made up by a mixture of skeletal muscle and smooth muscle, while the inferior 1/3 of the esophagus is made up of exclusively smooth muscle. There are certain types of diseases that prefer one of the two layers of the muscularis externa. For example, scleroderma creates an atrophy that predominantly affects the circular muscle layer, while in achalasia there's an hypertrophy of the circular muscle layer as well. And finally, only 1 to 2 centimeters of the abdominal esophagus in the peritoneal cavity is covered by the serosa. The rest of the esophagus, meaning the cervical and the thoracic esophagus, is only covered by adventitia. This lack of serosa that acts as a barrier is the reason that esophageal cancer metastatizes quickly. And that's it for today's esophageal histology video. In the next video we will see the clinical application of these important histological concepts. If you would like to read more about the topics discussed in this video, I'll put my reference down below in the description. Also, if you have any questions, please don't doubt to write it in the comment section. Before you do, make sure that your question wasn't asked already. If it has, please give that question a like, and the 3 questions with the most likes will be answered in the next video. Hey guys, thanks for watching. And remember, it's always for our patients. If you like this video and the content I make, please don't forget to subscribe, like, and share this video. With your help, I'm sure we can get free medical content to every corner of this world.